There's certainly lots of times when the general practitioner might want to, because they are the primary gatekeeper a lot of the time
Mm.
for because they're managing so much of what the patient's having to sort of deal with, and they optometrists are much easier to access than ophthalmology. And certainly a lot of the times when you want to find out something about someone's eye health or their vision, it may not be necessary to see the ophthalmologist, who is much harder to get into and obviously more expensive. And given that optometrists are well trained in triaging most eye conditions, and we're able to directly refer to ophthalmologists, we're a good gateway to get through to see if it's really necessary for the expense or trouble for a patient to go and see an ophthalmologist. It could be other things that we're sort of working with. So, people in their elderly years who need to get their license kind of signed off, then quite often we're doing the vision part of that medical workup and filling in the forms from that point of view. Often the vision measurement, vision chart, the ability to measure vision in the GP's practices can be a little limited. It's not something you're familiar with doing all the time. Then obviously that's our bread and butter kind of
Mm.
training. And then if people need visual field tests and other kind of tests, then we can take it from there. And
Mm.
obviously, look, if you're in that age group, then you're a higher risk of general eye health issues. So it's good for us to be able to kind of be managing that for them and reporting back to them.
Mm. So, so like I can imagine a lot of cases where the GPs refer their patients to you, but it also works back the other way, doesn't it? Like as an optometrist, like when you do a comprehensive eye test on someone, you're getting a lot of information about their general health condition from observing what you can see at the back of that patient's eye, like doing like a
Absolutely.
retinal scan. You can infer a lot about their overall health condition, can't you?
Yeah, look, and if we have got someone where we're seeing retinal signs of hypertension, blood pressure issues, or diabetes, and they haven't been diagnosed with those conditions, that's certainly something we can refer to the GP for. There's a two-way street when it comes to headaches. If a general practitioner is got a patient who's got unexplained headaches, then we'd form part of the sort of workup to see if there's any other signs that we can see in the visual system that might explain the headache, or at least rule out some of the more extreme, rarer conditions where we might be looking for papilledema, sort of swelling at the back of the eye that might sort of indicate something more sinister. And likewise, if we're trying to deal with someone who they think that their headaches are from vision, we might find that it's not. And so the next point of call will be a health workup with the general practitioner.
Hmm. Okay. So like headaches can often be a warning sign of other problems, can't they? Like we've talked a lot about, computers and computer use and how sometimes how that often leads to a lot of problems. I had an experience myself where whenever I used a computer, I was getting like pains like headaches at the back of the head, which kind of worried me. But it turns out it was like mostly just I think they call it a stress headache from just the way I was sitting when I was using the screen. So GPs, optometrists, and I guess there's a lot of detective work that you have to do to solve what's causing these issues, isn't there?
Yeah, and look, you get used to the common locations for headaches, and certainly if someone's coming in with a occipital headache, you can indirectly get that if you've got a vision problem because you're changing your posture to kind of
Mm.
force yourself to see. You can actually get pain that hits from behind the eye that can often be referred pain from a neck issue. So
Mm.
if there's a particular type of way that a patient might explain their headaches, or it kind of sounds like a vision headache, but we can't find a matching vision problem, and there's signs of tight neck and jaws and things like that, then general practitioner plus a physical therapist of some sort can help kind of work out what's going on for the patient.